All right. So, hey, good afternoon, everybody. My name is Marc Capogrossi. I'm with the National Broker Sales Team here at Elevance Health. And today we're going to be introducing Wellpoint individual and family plans for the states of Texas, Florida, as well as in Maryland. So let's talk about today's agenda. And hopefully this short amount of time, we're going to hit a lot of good stuff. But want to start off about who is Wellpoint. You know, we are new to these areas. We're not new to health insurance. So I want to kind of give you a brief overview of Wellpoint and the family of companies that we are with. Also, when you talk to and offer these plans to your members and to your clients, which will be Wellpoint members, what tools and resources are available to those individuals to make sure they have a really good experience with the health insurance plans that you put them with. That's very important to me. Also, from an agent broker perspective, understanding the tools and resources that are available for you. Then we'll jump into the different products, what's available kind of in those states, as well as the different service areas, and also provide you the broker support phone number and email address. And I know this is being recorded, but if there's any questions, I definitely will take them from the audience that's here today. With that being said, let's talk about Wellpoint. So Wellpoint is a part of the Elevance Health family of companies. About 2 years ago, the company was branded originally as Anthem, and then we rebranded it a couple of years ago, to the name Elevance Health. Elevance Health is now the parent company of Anthem, Blue Cross Blue Shield. You see Wellpoint, Carelon, who is our pharmacy benefit manager. If you're down in Florida and you see Simply Healthcare, that's the Medicare version there in the state of Florida. But overall, you can see that Elevance Health has a group of health insurance-based kind of companies underneath it that deal with networks, national accounts. We have a plan over in Puerto Rico. I mean, we've been in the health insurance gig for a very long time, and we're very financially strong. From y'all's perspective as agents and brokers, understanding that Wellpoint is and Elevance Health has been in the ACA game since the beginning. So we know how it works, we know how it operates. And as we go into Florida, go into Texas and Maryland, I know you guys and agents that have sold in Florida and Texas, for example, have seen carriers come in and dissolve, like Friday Health Plans and or Bright Health. So just to let you guys know, we're super financially strong. We're a Fortune 20 company, we've been in the health insurance market for a long time. And I think one thing you'll see with the tools that we have available, not just for you to brokers, the tools and resources we have available to those members to make their experience a delightful one, if that's a good word to use for health insurance. We actually cover right now around 46 million people nationwide. We have over about 100,000 associates here at Elevance Health. And as we expand into the states of Texas, Florida, and Maryland, that's kind of what we're going to focus on. I will say that it's been pretty exciting to look at expanding into these markets. And so far, I've gotten some really good feedback so far. So hope I get the same from you guys. So I always like to start with your clients and your members, because as long as they have a great experience and they know the tools that they have available to them, hopefully they'll have a good experience and they'll be able to find this information themselves without having to call you every other day to help with ID cards or find doctors. So two of the main tools that they have available, one is to simply go into wellpoint.com. Wellpoint.com, as a member, they can go click on member services, member support. They can log in or register if they're a first-time user. From there, once they get in there, they'll be able to find pretty much everything they want from their computer. They can find ID cards, they can look at billing claims, prescriptions, find local providers, pharmacy, they can download their healthcare records. They can also do an online virtual visit with Live Health Online, which is our virtual partner. But all of those resources are there for that member at wellpoint.com. If the agent or if your client wants to go out there and look for additional doctors, they can do that as well at wellpoint.com by simply clicking on Find Care. They can go in there and put their ID number in there if they have a member card, or they can go in there and search as a guest. The good thing is in these states that we're discussing, we're only utilizing one network. So once they click medical plans or network and then choose individual medical policy, it will only bring up one network for the states of Florida, one network for the state of Texas, et cetera. I also want you as agents and brokers to know that this is also a good spot for you to go out there and check the network yourself. If you guys are using a third-party quoting engine that allows you to, do a doctor search, do a hospital search, do a prescription search, that's great. If for some reason that tool breaks or you no longer have access to it because that information is not there, you can always come to wellpoint.com and do some of those doctor searches. The main thing I would say, if there's a couple of things that I would write down from this presentation, this is one of them. This is our award-winning Sydney Health app. And your members and your clients that you enroll with Wellpoint will have access to download this to their smart device, their Apple phone, the other phone there that they have, and maybe their tablet. But the Sydney Health app it gives people that pretty much 24/7 access to all their information right there at the convenience of their phone. Seems like everybody has a phone nowadays in their pocket. To imagine them having and be able to find their benefits, understanding their claims, being able to access their ID cards, which if they go to a doctor, they can email and or fax those ID cards over to that provider while they're standing in front of them, without having to call you as the broker or your agency for additional service. So to me, that's huge. They can, if they have a premium on their on their policy, they can go in there and make a payment, order prescriptions. Our pharmacy benefit manager, our PBM, is a part of our Elevance Health company, so they can do that through the app. Download, view health records, find doctors. Also, they have access to find and do a virtual healthcare visit. If people aren't feeling very well, they can actually open up their app and do that virtual visit right through the application. I can't tell you that how great of experience someone would have if they downloaded this application to their phone and actually started to use it. You can see we have close to 15 million plus, close to 16 million registered users. We have a 4.8 star rating on the Apple Store. That right there tells you that people are very happy with this app. If you look at the app itself, you can see there on the first one, you can see how easy flowing it is. It's very simple regardless of how technical, advanced somebody is or is not, it's pretty much out there and very, very easy to follow, very easy to flow. Your ID cards are there. You see some medical records in terms of claims. And one thing I would say here on this last little screenshot is, how can I help you? So if an individual is looking for something within the app and they're having difficulties, they can actually just go here and type in what they're looking for. This is a little built-in AI or artificial intelligence built into the application, which you ask it a question and it will go out there and at least try to do its best to find it for you. So again, this app is great for the overall member experience, which I think is going to be huge for us there in these new markets. Looking over here at the Sydney Health app, you can also have your providers, your clients actually go to a virtual doctor through the app. One thing you'll see is that these virtual care visits are absolutely free, and it is actually in the plan name itself. So be prepared to be able to answer some of those questions by pointing them to the Sydney Health app. So if someone is sick, not feeling good, pink eye, rash, allergies, whatever, they can actually see a doctor right through their phone. They can do it from the comfort of their home. They can do it from their office, their work, to and from work. Maybe they're stuck in traffic somewhere. Maybe they're just waiting for their kids to come from school or daycare. I mean, life is busy, and to take an hour, 2 hours to go to a primary care doctor or urgent care, sometimes it's just not doable. So this is a great option for a lot of people. Also, with mental health being more of a concern today, members can also access a licensed therapist for stress, anxiety, depression, family issues, and or other health concerns. And they can also make an appointment with a therapist if they need it. So there's a lot of great stuff in this app, and I'm just kind of skimming some of the highlights, but definitely encourage people to download this app if they enroll into a Wellpoint plan. Also, part of our plan, we do have the words incentives in there. And so one of the things I always like to go over is just make sure people are aware of them. Our incentives, our incentives are not nearly as strong or as rich as maybe some of the other ones out there in the market and other carriers. But our incentives are, we encourage people to go get a wellness check or a well woman's exam or basically a physical within the first 90 days. If they do that, they'd actually qualify for an e-gift card of around $50. That e-gift card would be an assortment of different vendors. And I think that they also have an e-gift card for a Visa card if they want to do that, which is nice. You can also complete a health risk assessment, which they can get another $25 for that, a total of $75. But this year, that's new with our health risk assessment. It kind of ties into Elevance Health Social Care Program, which is our Community Connect Care and our Ground Game Health. And what that does, it really helps people that need assistance or help with housing, utilities, food, transportation. And when they complete that health risk assessment using the My Health check-in tool, once they determine someone who is eligible, someone's going to actually reach out to them and provide some of those additional assistance. So I know it's only $50 for an exam and $25 for a health assessment. But for some people, it might be a lot more than that, just based on their needs and what they need help with. From the agent broker community, once you are appointed, and when you get appointed, you actually going to have to register yourself here at the Producer Toolbox. Once you're licensed and you're registered and you start writing business with Wellpoint, you can actually go into your Producer Toolbox from wellpoint.com and be able to search for these clients. You can find their ID cards straight from the dashboard. I know how frustrating it might be sometimes to be able to offer a health insurance carrier where you can't go to their portal and pull an ID card for a client that needs to go to a doctor. You have to give them a number to the carrier for them to have to fend for themselves a little bit. That's unfortunate. Again, having them download the Sydney app, or if they're in Wellpoint, you can go in here to your Producer Toolbox and download it and email it to them fairly quickly. It's very, very easy. Also, you can go in there and pull billing reports, kind of start to figure out who of your membership is running late on their report, on their bills. If you see anybody that's continuously late, maybe that's somebody that you reach out to and work on setting them up on auto draft. Members that are aging off their family plan, turning 26, or maybe they're aging into the Medicare world. You want to know who those members are so you can keep them. You can either write them a new ACA or send them over to the Medicare side of it. Of course, you have all access to the summary of benefits, prescription drug list. You can also set and develop delegates, users for your login and password. That would help, if someone's looking to provide some assistance. You can also, if that person decides to leave and go do something else, you can go in there and delete their access so they no longer have the ability to log into your portal. So there's a lot of good stuff. I'd also say that once you start writing some members in for next year, we will also have some renewal reports in there too that will give you some guidance on kind of what your members are getting and what they can expect for the 2026 calendar year. You can see right here, this is probably the other thing I would ask you to write down. This is the wellpointbrokerhub.com. I also added a QR code there in case you want to take a screenshot or whatever you wanted to do. But this is where we're housing all the Wellpoint broker and agent information out there. This is a place that will house it all in terms of product grids, sales kits, network grids, maps, service area maps, some marketing material, information about the Sydney Health app, Producer Toolbox. Everything's out there. And it's both in English and Spanish. Based on your language preference or your market that you're going after. So definitely encourage write Wellpoint Broker Hub down, or of course take maybe a screenshot of it to be able to access it at a later time. As I mentioned, you'll see the sales kits out there. You'll see some flyers and knowledge center stuff. You'll see some HSA flyers, but also you'll see these service area maps that will kind of help better understand kind of where we're going to be offering Wellpoint plans. Yeah, so for the calendar year 2025, and let's jump into some of the stuff that we're going to have available. But first thing I'd like to introduce or show you guys is, maybe you guys have seen this already, but some of the ACA copay type plans that are, non-HSA, non-high deductible health plans, the out-of-pocket max on those plans are actually going down this year from it went down $250 to $9,200. For the HSA high deductible health plans, that actually went up to $8,300 for an individual. Pretty exciting to see the out-of-pocket max go down. Looking at understanding how we name our plans, there's a lot of information within the plan name itself. The first you'll always see is Wellpoint Essential. That is the network that we'll be using and utilizing in each state. It will say Wellpoint Texas, Wellpoint Florida, Wellpoint Maryland Essential. That will be the network name. You'll always have the metallic level, the deductible. Some plans do have adult dental vision embedded into them, which again, you'll see that in the plan name if that plan has it. And the things that we just kind of talked about, we talked about two of the three of them. We talked about the virtual PCP visits. That's through the Sydney Health app, where people can go do online virtual visits at no cost whatsoever. Also, I forgot to mention Life Health Online, that virtual visit PCP, they can send a prescription down to your local pharmacist if needed. It's great for people that may be outside the service area, maybe somebody that's outside the state traveling for whatever reason. It's all free regardless. We do have a select drug list. The select drug list is located out at the Wellpoint Broker Hub. Regardless of the plan that they are on, these lists of generic, highly used generic medications are all absolutely free. And we did talk about the incentives as well, and that's kind of why we went over them, is because they are going to be a part of the plan name itself. On the second example, you can see that I highlighted like the network type, the POS. There is some point of service plans in the state of Texas, but if it's not a POS or you don't see a network type in there, like example one, it's going to be an HMO. For some of the cost share reduction plans, those are those modified silver plans that people qualify, because part of the Affordable Care Act was to make plans affordable to purchase by utilizing subsidies, but they also make it affordable for some of those people under 150% of the federal poverty level to be able to access that care and be able to afford to go to the doctor. You can see that's indicators at the end of the plan name, like S06, which is that 94% actuarial value plan. That's that rich plan on the silver plans. In brief, actuarial value is in simple terms that it's kind of the percentage that the insurance company is actually going to cover or pay for your care. So covering 94% is a very, very rich plan. And just wanted to kind of make you guys aware of those indicators if that question comes up. But let's jump into Texas. So the main thing here is that we're going to be offering these plans in 24 counties. And we will have the pediatric vision benefit built into these plans. So no pediatric dental, just pediatric vision only. In Texas, we're offering the HMO and the point of service. I will say that on these point of service plans, they do give an in-network and out-of-network benefit in the state of Texas only. So if it's an in-network or out-of-network in the state of Texas only, unless it's an emergency and they need emergency care or urgent type care, then it would be covered in network regardless of where they're at. And that is true for the HMO as well as the point of service. So I'll say that again, for the HMO and point of service, it's covered in network as if it's deemed an emergency or the individual is needing urgent care. If it's a point of service, it's in network and or out-of-network benefits in the state of Texas only. Just wanted to make sure I was clear on that. We're going to be offering both on and off exchange plans, bronze, silver, gold, catastrophic. These are open access, no gatekeeper. So if your member needs to go seek care from a specialist, go for it. You don't need to make a stop by your primary care and get a referral. Also, we do require a mandatory PCP selection. You can do that at the time of application. If you guys, if it's not working or if you want to skip it, that's fine. We will auto assign a primary care to them. And if they want to change it, they could also change that at a later time if they choose to. Offering standard and non-standardized plans, and you'll see the network there, the Wellpoint Texas Essential. I typically don't even talk about the pharmacy networks. I mean, our networks for the pharmacies are pretty robust. In the number of years, 15 years, that I've been here at Elevance Health, I've never had an agent call and say, hey, my client cannot get their prescriptions filled. I've never had that. So I typically just kind of brush by and keep going. But on the key factors and key features that I kind of hit most of this already, but again, having that virtual PCP visit for free through Life Health Online is huge. Having access to a lot of those highly utilized generic medications at no cost are all great. And having that embedded adult dental vision in some plans is also great. Also note that there is not going to be a standalone dental and vision plan with Wellpoint for 2025. These are going to be embedded and embedded only. So let's talk about the counties. So we're going to be available in these 24 counties. It's going to include major cities, kind of like, not kind of like, but like major cities like Houston, over in Dallas, Austin, El Paso, Lubbock, and San Antonio. You can see the service area map. That's also available at wellpoint.com. I mean, the wellpointbrokerhub.com, excuse me. But this is just a quick glance of some of the hospital systems we have there in Texas. I would say this is not all of them. This is probably going to see most of your major and or regional hospital chains, but I wanted to put something in here. I know that they've already started to add more hospitals, both in Texas and Florida, but I just want to make sure that if you're not seeing your hospital or a hospital that you want, I would go out to wellpoint.com and just check. Like I said, we are continuing to add doctors, specialists, as well as hospitals to these networks. But in Houston, I've understood that Methodist or St. Luke is a really good system. The University Health System there in San Antonio and Austin is really well. Over in Dallas, you have the Parkland, Tenet. Lubbock, you have UMC, and in El Paso, you have that Tenet, and or maybe I think it's called Providence Memorial. And you can see some of the plan designs. These plan designs are located out at the Wellpoint Broker Hub if you want to take a glance. But you can see here on this example, on the last three of these plans, the S04, S05, S06, those are those cost share reduction, those modified silver plans. And that S06, which is that 94% actuarial value, has that zero deductible, out-of-pocket max at $2,000. No cost for PCP, $10 for specialists, $5 for urgent care. It's a pretty rich plan. Yeah, it's rich, really good. So you guys can look at the benefit grids out at Wellpoint Broker Hub. I'm not going to waste your time by going through all that. Jumping into the Florida, only offering an HMO there in Florida. We will have that embedded dental vision as well as the pediatric vision benefits, and we're going to be available in 24 counties. Oops. Very similar slide as before, HMO only, in-network benefits only, in-state, unless it's deemed an emergency or requires urgent type care. We do have on and off exchange, bronze, silver, gold, catastrophic. It is also an open access plan, so no gatekeeper, no need for a referral to seek care from a specialist. There is a mandatory PCP. Again, if you don't select it, or if the system won't let you, no problem. We'll auto assign it. We'll change that later if they choose to. Wellpoint Florida Essential is the network. And again, we've kind of hit this over here in terms of some of the key factors. But again, in Florida, having the adult dental vision in some of those select plans, no specialty plans for, no standalone specialty plans. And these do have pediatric vision for the children only. Getting into some of the better stuff here. Yep, we have the list of 24 counties that we're going to be available in and that we'll be servicing. Mostly Central and South Florida, which includes like Fort Lauderdale, Miami, Orlando, Palm Beach, Tampa area. And there's the map for you. That map is again located at wellpointbrokerhub.com. So go out there and pull that if you'd like. Some of the hospital networks here in Florida that I've heard are pretty good there is, of course, in Central Florida, you have the Advent Health Community Health System, as well as the HCA Healthcare Network or systems. Down in South Florida, you have Tenet, Tampa General, as well as the Cleveland Clinic, which everybody I think's heard of the Cleveland Clinic. And they also have a facility just north of Orlando too, which was great for the people of Florida. Again, some of the benefit structures, you guys can go out there and take a look at them. I know you guys know how to read benefits, so it's all there for you to take a look. All right, and for Maryland, so Maryland, we don't have any service area maps because we are going to be servicing the entire state of Maryland, both rural and urban areas, offering the HMO plan. We're in Maryland, we actually have embedded pediatric, dental, and vision for children under 18 in the state of Maryland. You can see that we're offering the HMO only, both on and off exchange, bronze, silver, gold, catastrophic. Same structure as the other states, open access, no gatekeeper, no referral required to go seek care from a specialist. We do have a mandatory PCP. Again, if you put one in there, great. If you don't, we'll auto assign it. They'll change it at a later time. There's the Wellpoint Essential Network, Wellpoint Maryland Essential. All key factors or key features we've mentioned before. The big difference here in Maryland is the pediatric, dental, and vision is the one I just make sure we hit. You can see some of the hospital systems that we have here in Maryland. St. Aegis Hospital, Greater Baltimore, Atlantic General, Advis Healthcare, Shady Grove, White Oak, Fort Washington, all in, as well as the Frederick Health Hospital. Again, for all the network information I provided, all that is subject to change, of course, but I would say we're probably going to be adding more as the time goes along. So definitely always keep your eye on it. Always check it. I know a lot of the quoting systems out there do it for you, but just keep your eyes out for that. The plan names, you can kind of see everything there. And that, of course, is out there at the Broker Hub. I did mention that we are doing on the Producer Toolbox for both on and off exchange. If you have a customer that needs off exchange, you can go and do that at the Producer Toolbox. You can go in there and run a quote under Book of Business and run a quote for both on and off exchange, mostly on exchange in Florida and Texas only, because Maryland is a state-based exchange. So you'd have to go through their state exchange to receive a subsidy in the state of Maryland. But just letting you guys know, if something happens to the quoting systems, that you have a backup right here at your broker Producer Toolbox. Pains in these markets really is more of a brand awareness. So if you do live in these states, you may see some commercials on TV, which will both be in English and in Spanish. You'll also see digital social media ads, as well as billboards in these markets. These are really more just as a way for letting people know that are in this ACA space that there is a new player and a new option for everybody that's in those markets. So pretty excited about that. Also, just to let everybody know, we'll be on Health Sherpa in the Wellpoint states. So that's great. So you should be able to find and do your doctor and provider searches, as well as your medication searches for your clients through that Sherpa system. So with that, sure that you can go to wellpoint.com if you need any assistance finding stuff for your customer, because as I mentioned, the producer toolbox will house all that information. If you need assistance or have additional questions, you can call broker support anytime between 8 and 5. That is local time, so depending on where you are, doesn't matter. We have a call center, support center there in Kentucky, as well as one in California. That would assume that time would be expanded as open enrollment starts to open up. Also, if you need to email, maybe it's after hours, you can email broker support at wellpoint.com. These are being ticketed, so we want to make sure that these emails are being answered as fast as possible, but also making sure that questions are also answered. So wanted to make sure you guys have the phone number as well as email address to access some broker support. And outside of that, that's all I really had for the day. If anybody has any questions, or great. If not, I hope you have a great open enrollment, and hope you guys have a ton of business for yourself, and hopefully you put well in the mix. Thanks again.
They will, Mark. Thank you so much. What a great amount of information again, and a ton of value that you're bringing to our agents today. So I really want to just again reverberate just so much for the time that you spent with us. I know that you mentioned Q&A. I'm sure our agents will have questions. We'll get those questions over to you, Mark, so that you can answer them. And we are going to try to set up a secondary call with Mark for those that are interested. Obviously, we want to sell Wellpoint. We want to make this a successful open enrollment for everybody. But if you have those questions, we're going to set up a secondary call with Mark in a live format here in the coming weeks. So be on the lookout for that as well. Mark, thank you again. I really appreciate your time today, man. And listen, we're looking forward to having a great open enrollment with you.
Absolutely. Yeah, guys, good luck, and hope you enjoy the rest of your conference.
Thank you so much, Mark.